We are back! That's right, we are back. This is the Ethnic Health Disparities Podcast show, and my name is Dr. Bailey, Dr. B, and this is show, what is it? What number show is this? This is show number 7. Show number 7 of the Ethnic Health Disparities Podcast show, and we are still we're getting into the data. We are analyzing the Center for Disease Control and Prevention data, the Health Disparities and Inequalities Report. This is analyzing health disparities data number 3, and we're focusing on healthcare access and preventive health services. There you go. That's right. This is analyzing health disparities reports, and this is number 3 report. And it's focused on healthcare access and preventive health services. So there you go. I'm getting straight to the point. That's right. Just to let you know, if you have any comments, send your emails to me at ejb678@gmail.com. You can like us. You can subscribe to our podcast. We are on iTunes. We are on Spotify. We are on Podbean. And yes, we are even on YouTube. You can listen to us on YouTube. We start doing that on show 5 and 6. And now you can view us, listen to us on YouTube. So, again, I want to thank everyone for acknowledging us, for liking us, and really supporting the show. Because, again, this is one show. As I continue to do more and more, there's not this continual dialogue in the podcast world. Hello. There is not a podcast like this discussing, breaking down ethnic health disparities issues. So, again, I feel obligated. And plus, I just love doing this. and we're looking at healthcare access and preventive health services. We're breaking down that CDC report. In show number 5 and 6, I looked at social determinants of health. Show number 6, I look at environmental health issues, environmental hazards. And this is show number 7, and I'm looking at healthcare access and preventative health services. There you go. Okay, here's what the CDC Health Disparities and Inequalities Report, United States 2011 report states about healthcare access and preventive health services. Did I cover all my bases? Yes, let's get to it. Health insurance. There's actually, in this section, 3 particular areas. Health insurance coverage, influenza vaccination coverage, and colorectal cancer screening. So, again, I like going through the data. And these shows right now are going through the data. And I'm breaking down the data. Come on now. It's time to be real, folks. And let me go through this data. Health insurance coverage, United States, 2004 and 2008. Insurance coverage is strongly related to better health outcomes. Substantial disparities in uninsured rates were observed among all demographic and social economic groups. That definitely makes sense. Substantial disparities in uninsured rates were observed among all demographic and social economic groups. So, again, people are uninsured. And we see this from the different demographics and social economic groups. Disparities by sex existed during both 2004 and 2008, with a higher percentage of males being uninsured. Wow. Well, that makes sense too. Men, hello, I'm one of them. We feel like we don't need to be insured. That's wrong. Okay, that is wrong. And when you have a higher percentage of males being uninsured, therefore, you're going to see some outcome of that. So they see this by sex, by gender, 2004 and 2008. Next, the uninsured rate for young adults aged 18 to 34 years was approximately double. That's right, double the uninsured rate for adults aged 45 to 64 years of age. So the younger segment of our society are uninsured, tends to be uninsured, and that's double the rate than the 45 to 64 year age group. And I can understand it. You know, you feel like you're healthy, you don't need insurance, and plus the cost of it. Wow, that makes sense, but it's not good. Okay, I understand it, but it's not good to have our 18 to 34 years of age adults uninsured, double the rate. There's a lot of factors in response to that. Let me move on. Here we go. Hispanics and non-Hispanic blacks has substantially higher uninsured rates compared with Asian Pacific Islanders and non-Hispanic whites. Wow. Hispanics and non-Hispanic blacks has substantially higher uninsured rates than compared to Asian Pacific Islanders and non-Hispanic whites. So, what we see is, we see a direct outcome of not being insured and problems with certain health outcomes, health problems, medical problems, causes of death are directly related to being uninsured. When you're uninsured, you're Hispanic, non-Hispanic, black, younger, and belonging to certain socioeconomic group, demographic group, you will see an unfortunate outcome of lower life expectancy. Then it further says, increased access to health care with or without insurance will reduce the importance of disparities in uninsured rates. Wow, of course. Increased access to health care with or without insurance will reduce the importance of disparities in uninsured rates. Yet, here we come, the Affordable Care Act, as the country knows the Obamacare. I don't like the terminology. It's the Affordable Care Act, okay, under previous President Barack Obama. And basically it's trying to get as many folks insured who have been uninsured. That is an important element in our country. And now it's 2019 and lots of these issues now, yes, are being repealed. When so many individuals simply do not have the means, the income, or we're talking about the younger age group. We're talking about Hispanics and non-Hispanic blacks who are uninsured. And when you make it more difficult for these segments, guess what? It's going to have more of a burden on our health and medical systems. Hello. It is straightforward. It is just as simple as that. But if we increase access to health care, and people do need insurance, we need to build that in. And yes, it's not the end all. And I'm the first critic of it. I said, yeah, you can provide insurance, but that doesn't mean everyone's going to go seek care. And then, in fact, everyone hasn't gone seeking care. We've increased the numbers who are insured over 40 million folks since the Affordable Care Act came into play. Yet there's millions more who need insurance. But insurance is not the only thing that brings folks in to get their health care reviewed, assessed, or their medical situation assessed, diagnosed, treated, and for individuals to stay in the health and medical system. So, yeah, health insurance is extremely important in 2019. And we're not trying to make everyone pay for it, but there's opportunity for the federal government, private industry, companies to support those who are contributing through their taxes with some health insurance. Hello. And yet we should not penalize for those individuals who decide not to. No, I definitely agree. If people don't feel like you shouldn't be penalized just because you don't have health insurance. That's not right. But we should make it a very viable and appeasing option. Get your health insurance somehow, some way. When it's not an extra burden on you, and it's hard for when you know the groups, Hispanics, hello, non-Hispanic blacks, hello, that's me. Okay, age, we realize that 18 to 34-year-old, it's hard to purchase health insurance. As a matter of fact, yes, I am supporting one of my older kids because he can't really afford the health insurance at his age. So that makes sense. So he's under my care. Most working adults will do that for their kids. So health insurance coverage is very important. But in essence, we see substantial disparities in those who are uninsured of all demographic and socioeconomic groups. Okay, let me move on. Number 2, under healthcare access and preventive health services, influenza vaccination coverage, United States 2000 to 2010. During 2009 and 10 influenza season, however, lower influenza vaccination coverage was observed for non-Hispanic blacks and Hispanics compared with non-Hispanic whites among all persons age greater than 6 months. Although racial and ethnic disparities in childhood vaccination coverage have improved throughout the past decade, substantial disparities among adults aged 65 years and older have persisted. Evidence-based interventions targeted at reaching minority populations include use of reminder call systems, standard orders for vaccination, regular assessment of vaccination coverage levels among practices, immunization registries, improving public provider awareness of the importance of immunization for adults are needed to eliminate health disparities. That's a political statement. That's a policy statement. That didn't make sense to me at all. Again, evidence-based interventions targeted at reaching minority populations using these generic types of interventions. Nothing, again, I'm a cultural medical anthropologist. There was nothing culturally related to this. And no wonder why there's lower vaccination coverage by non-Hispanic blacks and Hispanics. There's nothing culturally related to these interventions such as reminder call system, standing orders for vaccination. What the heck? Regular assessment of vaccination coverage levels, immunization registers, improving public and provider awareness of importance of immunization for adults. That doesn't relate to me as a person of color. It doesn't relate. There's nothing cultural there's no connection to these interventions. Again, stop being so generic in your interventions, CDC. Yes, I said it, CDC. Okay, come on. Influenza vaccination coverage. Yes, you're going to see that. There's nothing about beliefs. And there's a lot about the issues of beliefs and misconceptions and stereotypes about vaccinations among various groups, particularly racial and ethnic populations, have all these misconceptions. Socioeconomic groups, we see this among many times lower socioeconomic groups, have all these misconceptions and stereotypes about vaccinations. Hello, I'm a supporter of as many vaccinations as possible. Yes, I work for the federal government. I believe in vaccinations. Okay, very, very important. Get your vaccinations. Get your immunizations every year or whenever it's available. It's very important. It's reassurance to protect you. Hello. So Dr. B is in full support of vaccination coverage, particularly influenza vaccination coverage. Get it. And address those cultural beliefs, values, perceptions at another time and place. Get your coverage. Okay. Yes, I'm challenging all groups, cultural beliefs, values on that issue. Okay? Yes. Dr. B is challenging it front and center. Wow. See, I'm going both ways. I'm not on one side. I'm on all sides. But I'm in a not sensible, but in a practical public health and medical. Because it not only protects you, it protects everybody else in our public. Hello, the millions of folks who need to be protected from those who are unprotected in vaccination coverage. Because we live in a dense population, every city, even in every rural area. Get yourself covered in vaccinations, influenza vaccination every year. I do it in my household every year. Kids get vaccinated for influenza. It's mandatory. Particularly college students. Because much exposure to other students in a dense population, you need your college students vaccinated. You need your kids who are in public school or private school vaccinated. We need older folks, elderly folks, individuals like myself in their 60s vaccinated every year to protect yourself. Hello? Yeah, this is a big issue for me. Seen too many folks hold on to those old school, old-fashioned beliefs, misconceptions of their great-grandparents. Okay, I love my grandparents, I love my great-grandparents, but guess what? Many times they were doing things a little bit old-fashioned, a lot old-fashioned, and I challenge my parents on a lot of issues. That's the reason why I'm in public health and medicine. I'm a medical anthropologist in public health as well. So we're going to have a show on that too. Where many times the next younger generation sometimes have to challenge their older generation. And that's what I did as a kid. I'm going to be truthful. And influenza coverage, medical care, public health is very important. So there you go. Here's number 3. I'm 18 minutes in. I'm almost done here. Colorectal cancer screening. Very important. 2002, 2004, 2006, 2008 report. The findings of this report indicate that although overall use of colorectal cancer tests increased from 2002 to 2008, disparities exist in the prevalence of colorectal cancer testing among certain groups. Persons aged greater less than 50 years of age who have reported had tests within recommended intervals was greater. However, the proportion was greater for non-Hispanic whites compared with all other races, men compared with women, persons with disability compared with those with no disability, the persons with health insurance compared with those without any type of health insurance coverage. Coordinated efforts should continue to address barriers and disparities in screening so that the incidence and comorbidities associated with colorectal cancer can be reduced among all populations. Man, I just get tired of these tag-along policy statements. Coordinated efforts should continue to address barriers. Be specific. Come on. No kidding. Don't summarize a key issue like colorectal cancer screening. Extremely important. And we need continual testing at all ages. At certain ages, when you get a certain age, you need your colorectal cancer screening consistently. This is a problem. We need consistent testing and screening. And of course, the proportion was greater for non-Hispanic whites compared with all other races. Men with women, persons with disability compared with those with no disabilities, and persons with health insurance. Of course, they have more screenings compared with those without any type of health insurance coverage. So let's provide specificity in the issues of colorectal cancer screening. So there you go. My gosh. Again, issues in healthcare access and preventive health services. There are issues of colorectal cancer screening. There are issues of influenza vaccination coverage, as well as health insurance coverage. These are critical issues of why people do not seek care or do not have regularly seek access to their healthcare providers or their medical institution, and developing a pattern and practice of preventive health services. Every group, and let me just say, everybody practices varying forms of preventative health services for themselves and their families. Everyone does in some form or fashion. But we have to improve some of the preventative health services practices by various groups in their own way that's culturally competent, so all of us can be as preventative as possible, that adheres to your values, your beliefs, and your history. And sometimes those preventative strategies have to be changed. Oh yes, they have to be changed. And we do need health insurance. All types of health insurance. Everyone can contribute in their own way, as best way they can. Should not penalize for those individuals who do not have health insurance, or who cannot afford it. There has to be other options. The government can provide subsidies. Companies can provide subsidies for others. And you cannot penalize the middle class for health insurance coverage again and again. Hello! That's what I do differ with the Affordable Care Act, because the health insurance continue to increase. Hello, not good to penalize the middle class, the working middle class. Hello. So there you go. Healthcare access and preventive health services. This is show number 7, the Ethnic Health Disparities Podcast show. I am Dr. B. If you have any questions, please email me at ejb678@gmail.com. Subscribe to my podcast. I'm on iTunes, Spotify, Podbean, and yes, YouTube. Thank you very much, folks. Talk to you again soon. Peace out.